Okay, folks, you know this is the trade-off here in central Iowa. Every single year we get the beautiful spring weather and we get the allergies that come along with it. And a local expert is sounding the alarm today about the way we handle allergies when they turn into something worse, like bronchitis, sinusitis. Prescription opioids have been getting all the attention lately, but today's guest would argue that Americans are taking too many pills, period, and especially antibiotics. Dr. Andrew Miesner is an associate professor at Drake University College of Pharmacy and Health Sciences. Why has overprescribing antibiotics become a problem for us?
Well, if we just look at it from a financial perspective, the CDC estimates that about $21 billion per year is spent on overutilization of antibiotics and the drug resistance problems that come from it. Antibiotics are a special class of drugs in that the drug that is prescribed for you directly impacts how it's prescribed for me. If you have high cholesterol and you get put on a medicine for cholesterol, it doesn't impact how my cholesterol is treated.
So we're all in this together, right? And so when you're saying, overprescribed, does that necessarily mean drugs we shouldn't be taking that aren't for what we have?
Yeah, absolutely. The estimates currently are about 30% of the antibiotics that are prescribed in this country are unnecessary.
Okay, wait a second. So the CDC said that last year there were 250 million doses, or not doses, but 250 million prescriptions written for antibiotics. You're saying how many of those didn't need to be prescribed?
Yeah, about 30% on an outpatient basis and almost half of the ones that are prescribed in the hospital.
But they make people feel good. So what's the problem?
A lot of common conditions we're always going to get better, right? So, for instance, if you take something like sinusitis that you mentioned earlier, in about 10 or so days, 85% of the time, those patients will get better on their own. If you give them an antibiotic, they only get better 90% of the time.
So we just want to feel better faster, so we're willing to take whatever pill we think is going to get us across the finish line?
Yeah, and certainly that does come with some risk. If you do this enough time, if you give that many doses of a prescription antibiotic or prescription medicine to Americans, eventually you're going to start seeing problems.
Yeah, to Americans, to individuals. All right, you've got the people, and I hear this from people. They're like, the amoxicillin doesn't work for me anymore. I had to get a Z-Pack, and then the Z-Pack doesn't work anymore, and I got to get something else. That's a dangerous road to go down, right?
Yeah, absolutely. And certainly we see over time, overutilization. Even when I graduated from pharmacy school 10 years ago, maybe a Z-Pack was working, but now even locally we're seeing our resistance rates rise to sorts of bacteria that we would normally see in the community.
So we're talking about like people going into urgent care. They're getting more high-powered antibiotics now for things like a sinus infection than they would have 10 years ago?
Sure.
And that's just because we've been using too much of it for all this time?
That's part of it, yeah.
Okay. So what's the solution? How, people want to feel better. So how do we do it without abusing the antibiotics? Is abusing too strong a word?
It might be. One piece of this is demand. We know that patients do go in and they ask for an antibiotic. And in fact, if you go in and ask your physician, your nurse practitioner, your PA for an antibiotic, you're about 3 times more likely to receive an antibiotic when you walk out of that clinic. And we also know that patients that do not receive an antibiotic after they leave their doctor, their PA, their nurse practitioner, they actually rate their provider at a lower level. They are less satisfied with them.
So for us individually, we have the power to say, I'd like something else, or something over the counter maybe.
Yeah, and absolutely. A lot of things that you've described, like sinusitis, bronchitis, are very amenable to over-the-counter treatment and non-drug treatment. In a lot of cases, if you have some other risk factors like asthma or emphysema, then absolutely an antibiotic might be indicated in that scenario. But recognize that most of the time these are actually viral infections that will not respond to antibiotics.
Dr. Andrew Miesner, thanks so much for coming on the program this afternoon. I wish we had more time to dive farther into this. We'll be right back with more on the news at 4 right after this.